Taking the time, Dr. Morningstar, to meet me today.
For sure.
Um, I'm sure you heard some of that in there.
Yeah.
Okay. And so today, I have the privilege of sitting down with Dr. Morningstar. He's one of the most published researchers in alternative conservative scoliosis management in the world. He holds what, somewhere around 50 publications, Doc?
Yeah, like 63 or something, I think.
Yeah, just
Yeah.
just an obscene amount. He's the most published doctor that I know of in this world in conservative management, as far as working in what we do. He has some really great insights. He's the developer of the BackGenius system, which is more of a nutritional neurochemical support system. So he's looking at scoliosis for more than just the curve of what you see on an X-ray. He's looking at mechanistics biomechanically and biochemically on the inside, and actually what are contributing factors and actually possibly underlying causes. So we really want to get his opinion today, his ideas today. He's done some wonderful research on this, and so I really want to pick his brain and see what his research is doing and how we can implement that best for our patients. So, Dr. Morningstar, scoliosis is more than just purely a structural problem like what most doctors think, right? Most doctors see an X-ray, there's scoliosis, there's rotation, and that's a curve of the spine. But what does the BackGenius research suggest about what else is happening in scoliosis patients?
Sure. Well, first off, thank you for doing this, Dr. Dick. I appreciate it. But I would say what's probably the most frustrating part of this on my end when it comes to scoliosis management is that the stuff that we're doing is not necessarily something that we discovered. We're just actually using the information that was already discovered and actually applying it to clinical practice. So when you talk about the origins of scoliosis development or scoliosis progression in mild existing curves, there's information published, going on 50 years ago now that has shown that there are problems with neurochemistry that trigger the onset of scoliosis curves. But the problem is a lot of that research over time has been primarily academic. And so a lot of clinicians have really never bothered to take that information and try to apply it to clinical practice. Now, in a certain sense, I understand that because, at the end of the day, at least in the well, frankly, probably still most parts of the world, an orthopedic surgeon is the one still spearheading the management of scoliosis by and large. Well, if I'm an orthopedic surgeon, at the end of the day, my decision-making process primarily in a simplistic manner is, am I doing surgery or not? And if I'm not going to be talking to my patients about serotonin or melatonin or progesterone or all of these other things, even though all of these other things are part and parcel that either triggered the condition or allowed rapid curve progression to occur. But yet, nobody ever does anything about them.
And
And
so
we
that's
all
that's a
know well
that's a
and good.
great question, because the serotonin, melatonin, and the spinal deformity in plain language. Can you give a just a very basic mechanism of what's kind of happening and the evidence behind that?
Sure. So a couple of things. So I would say first and foremost, even if you just look from a normal neuroanatomy perspective, 80% of all of our peripheral nerve pathways, especially our peripheral neuromuscular pathways, are all mediated by serotonin. So if I don't have enough serotonin or my body's not processing enough serotonin, I'm going to have delays or firing issues, let's say, in those peripheral nerve serotoninergic pathways. Secondly, some of our neurochemistry and our hormones basically signal for our various body tissues to lengthen as we grow. For example, there are certain hormones and neurotransmitters that signal for our bones to lengthen, including our spine. But there are other hormones and neurotransmitters that signal for our spinal cord to lengthen and grow inside of that spinal column. So now, if I'm getting any type of disproportionate growth between the two, my body has to offload any difference or disparity in that growth lengthening between the bony column and the spinal cord and create a curve to offset that axial tension. But all of that was triggered by the actual neurochemistry and hormone disrelationships first The curve happened as an adaptive response, not as the primary problem.
And that makes complete sense since we see this, in an earlier, specifically in young women, young girls, as they're hitting their growth spurts, as their hormones are starting to kick in. And so it makes complete sense for the cascade that you're talking about and that to come into play. And so BackGenius, it sounds like, is really working at the biomechanic or biochemical level. How is that different from somebody just taking a melatonin supplement?
Good question. Well, to be very frank, sometimes it isn't. Sometimes it can be as simple as taking a melatonin supplement to help that particular person. But one of the hard parts with kind of trying to manipulate some of this neurochemistry is that there are a whole long metabolic pathways that involve various neurotransmitters. So just to use your example of melatonin is at the very end is the very end product of an entire pathway called the L-tryptophan pathway. Well, there are ways to where you can intervene at many of those points along the way to still get your melatonin up to where you want it to. Also, on the converse side of that, by taking melatonin, if I start taking a melatonin supplement, for example, and my melatonin starts increasing at a rapid rate, I might now start shutting down all of these other conversions upstream. And it might be some of these other issues that were actually contributing to the curve, not necessarily just the serotonin. And the problem is you don't know until you test for it.
That makes complete sense. Because it sounds like you're talking about just a big cascade of events that happens in there, not necessarily
Sure.
one single mechanism that's what's going on.
Right, right.
So when we're looking at the BackGenius protocol, what does that look like as far as testing and duration and retesting?
Sure. So most doctors that are in BackGenius obviously will do a normal clinical workup. It's just we sort of take it a step further and kind of add, a neurochemistry arm to it, if you will, where we try to dive into a lot more of a lot of other like what I would consider non-spinal symptoms of scoliosis. So as examples, a girl might have scoliosis, but when you really sort of interview her, you find out that maybe she also has difficulty staying asleep at night, or maybe she has difficulty with irregular menstrual periods, or maybe she has difficulty with irritable bowel syndrome. There are a lot of other organic health symptoms that kids with scoliosis much more frequently have compared to their peers, but yet they don't connect and recognize that these are all the same parts of the problem or different facets of the same problem. And but the presence of those other existing organic health symptoms allow us as the practitioner to sort of funnel down and say, okay, what are the primary body systems being impacted in this particular person's case? To then me knowing from that as the practitioner, what kind of testing am I going to order to drill down on how these things are impacting that person? Maybe I'm doing some type of a gastrointestinal analysis. Maybe I'm just doing a salivary hormone test. Maybe I'm doing a urinary neurotransmitter analysis. Or maybe if the child's very young, maybe they don't really have a lot of those symptoms yet. Maybe say it's a 6 or 7 year old. But now there's an established family history. Maybe a sibling has a curve, or mom or dad, or maybe grandma. And so now the family is really just interested in knowing it. What is this child's genetic risk of developing a curve as they grow and start to hit their main growth spurt?
Mm-hmm. Mm-hmm. All right. Well, it sounds like, with your background in structural correction and adding in this in, I would imagine that you're just getting much better results overall with looking at the chemical side of things, the hormonal cascade side of things, as well as the structural side of things, and just integrating them together.
Good question. I don't know if I would necessarily say the results are better than because I mean when you really look at all of the various scoliosis treatment methods that conservative methods that exist, you're going to see that every method has it and can claim its own successes. So to me, everything works to varying degrees. What I think ultimately the reason a patient might fail a particular treatment is because they're not addressing the entire condition. And it might be something entirely separate from biomechanics that causes them to fail their treatment approach. And not because maybe they didn't want to do it, but maybe they're never even given the opportunity to address those things in the first place. So I think the biggest thing with what we do is not necessarily about increasing success or the magnitude of success. I think it's more about eliminating treatment failure.
Gotcha. Gotcha. So have you seen cases where BackGenius produced unexpected results or even better results than you were expecting?
I mean, yes, in the sense that I definitely have had cases where, um, especially if you have young kids that you can get to very early in the process. Like so let's say a child who's only in maybe the low 20-degree curve threshold, and you can do different things exercise wise with them to entirely, resolve that curve over, say, a year, 18 months, something like that. um, the ability for them to maintain that change is much, much better when we add in all of these other components and start addressing them. Even if they get to a point where they're not even having to do the physical treatment anymore because the curve has already been resolved, we're allowed to able to maintain those changes better because we're addressing all of the underlying reasons as to why that curve was there in the first place.
Gotcha. Gotcha. So I kind of have a two-part question here for you. Just kind of hear me out. And so we know that the published literature now says that there's neurotransmitter involvement with AIS, and that there's some gaps that you've been working on filling, right? But what's the most significant thing in the scoliosis research community that doesn't quite understand about the neurological component of the spinal deformity? Like, where do you see the biggest gap that we're missing?
To be perfectly honest, I think the biggest gap lies in, what we chiropractors anyway have in the field called functional neurology. I think in a lot of cases, it's one thing to identify neurotransmitter problems, but in many cases, it's not necessarily just enough to supplement for those things. You have to also stimulate the areas of the brain that naturally produce those things, because not everything you take orally is necessarily going to get into the central nervous system. And so if I can develop functional neurology ways and incorporate those kinds of concepts into scoliosis rehab, things that, frankly, I hesitate to even call them exercises, but, different color therapy or cranial laser therapy and different things that we know have direct impacts on stimulating the production of certain neurotransmitters. Those are easy things to incorporate into any rehab protocol, no matter what flag you're flying.
Gotcha. That's amazing. Those are things that just are highly underutilized in our society today that we have. And I'm assuming you're using them in your clinic up there probably every day.
Every day, absolutely.
All right. For a clinician watching this who wants to dig deeper into this research behind BackGenius, where would they start?
Well, I mean, you can go to backgenius.com, obviously, and kind of look around. There are links there to like my ResearchGate, bibliography if you want to see a lot of that data. But again, a lot of the stuff, I mean, really it's just about going back and through and even just doing a PubMed search on, serotonin and scoliosis or melatonin and scoliosis. I mean, it'll take you down a rabbit hole that will give you a lot of reading for a while.
I
But
imagine.
I would say that's the easiest place to start.
All right. And from a parent's perspective, not necessarily a clinician perspective, you and I have both been seen patients that were just said, watch and wait, or here's a brace and just see what happens. What would you tell these
Sure.
parents about what you have to offer and what the Back Genius has to offer?
Sure, sure. Good question. So first and foremost, I would say I agree. There is no parent out there who is comfortable doing nothing. So the entire idea, we're in 2026 and people still recommend nothing as a treatment option. And no parent is comfortable with that. It's just because they're not given any other options at the ortho's office. They don't realize a lot of times that this kind of stuff is available and out there. And I think even to translate that into what you said with a bracing protocol, even in kids who just maybe only have access to a rigid brace and that's all they're doing. Well, there are a great many times where a rigid brace might be particularly helpful for that child, but again, they're not addressing the underlying reasons for that curve development. And so the brace is going to have a much higher risk of failure because they're not addressing the impetus for this problem. And so at least with the back genius concepts, you can be patients who or a family who lives, anywhere on planet Earth, and you can still add the back genius framework into whatever treatment method you're already doing. And even if you're doing nothing, you can still, okay, find out what is it about my child that allowed him or her to develop this curve in the first place and address it accordingly. That way they're
Right.
trying to get to a root cause idea.
And that was a money question right there. That was my money question for the day. And that's where I was going. You just answered it. Thank you. So I don't want to take up too much of your time, Dr. Morningstar. I know that you're really busy. I do want to thank you for your time and to have this conversation. You are, have many published articles out there. You are the leader of the BackGenius. We do offer the BackGenius here in Charlotte, North Carolina, and we can consult with Dr. Morningstar regarding your case. If you have any questions, please feel free to go to his website, look it over. You can go to our website at clearlifescoliosis.com as well. One of us we'd love to help you.